Thank you, Marin. We go on to Dr. Anup Chirayath. Anup is going to show us a novel placement method for iris hooks in small pupil.
A very good afternoon. So iris hooks is something we have been routinely using for to dilate the pupil. So this is what we traditionally used. We used 4 hooks so that we have a square shape. We have a good exposure of the cataract. But then the problem was that many times we face, especially in case of IFIS, is that this probe sometimes got engaged, stuck in the iris. So when we insert that, it lead to some stretching of the iris. Similarly, while putting the IOL also, we find that while the lens is being pushed inside, it tends to stretch. And probably people who are using in the beginning, one can even cause significant iris damage. So to prevent that, we came up with this concept of 5 hooks, which was definitely much better because this problem of the proximal iris getting stuck in the phacoprobe was not there. But the one small little problem was that the hub of the hook sometimes causes mechanical problem while inserting the probe. Similarly, while inserting the IOL also, that hub can be a problem. Though I generally put the hub slightly on the side of the clear corneal incision. Not a very big problem, but still it can cause some amount of mechanical disadvantage. So then what I thought was, if I put these hooks, the 4 hooks, in a slightly different configuration, that the proximal two, that is the one nearer the corneal, clear corneal wound, we place them slightly closer to the clear corneal wound, and the opposite ones we place them slightly far. So that in the end we get a sort of a trapezoid configuration. So the advantage is that this the part of the iris near the wound, that is like stretched taut because the 2 hooks are very close together. And the margin of the iris is almost coincides with the internal lip of the corneal wound. So whenever you insert any instrument, it will not engage the iris. One more case here. So these 2 proximal hooks, they're close to each other, so this iris is really stretched. The opposite ones you can keep far because you need more visualization so that more of the cataract is visible. So just by using 4 hooks, we can prevent the problem which used to come when we used it in a square configuration. I mean, the 5 hook technique is also good enough, but you can at least avoid using the 5th hook, and the 5th hook has that problem that the hub of the hook sometimes causes a little bit of a problem. So this was something which I did differently so that I could share with you. Thank you.
So my take is, I don't use these kind of hooks. I use either the Orolab or the Alcon ones, which are at least half the size of these hooks, and they are the stopper is also.
This is Orolab.
This one is blue kind of Orolab. Orolab now makes a brown one, which is thinner, and the hub and this one is very malleable kind of stopper. So those don't actually interfere with the probe at all if you place sub-incisionally. And my configuration is a diamond now rather than a square. A square if I have, then I'll put one more 5, but 5 is not required because you can have a diamond shape.
Yeah.
No, it's a very nice concept, Anup. Only thing is, David Chang introduced this concept wherein you go posterior to the main incision and put a stab incision there and put a sub-incisional iris hook. That will prevent the iris from coming forward, especially when you go in and come out, you know.
Yeah, that is the 5 hook technique that you do.
Yeah.
So either you can do that or have a diamond configuration like he said. So again,
or this concept also is very nice.
This is basically the original 4 hook technique, but
the top one,
the nearer ones you're having it more closer, so that it's.
Yeah.
Thank you.
Very nice.